voice. Hi, everyone. Welcome to Union Talk. I'm AFT President and your host, Randy Weingarten. As some of you may know, we started these virtual town halls at the AFT when the pandemic started. It began as a way to keep in touch with our members during COVID when everything was shut down early in 2020. And it was a way of keeping connected in order to share information about the pandemic, answer questions our members had by bringing experts together as we navigated through the ever-changing virus, and also having a Tuesday every week or every other week that people could rely on as the AFT Town Hall. After well over a year of doing this, it's become a permanent fixture of our work here at the AFT. And this latest town hall was a huge hit, so I thought it would be good to share this as an episode of our podcast. What you're about to hear are some parts of the town hall that we held on prioritizing safety for students and staff amid the new COVID surge as we are getting back to school. And we had many distinguished guests who really know what they're talking about. U.S. Surgeon General Dr. Vivek Murthy, Dr. Pamela Cantor, a physician and founder of Turnaround for Children, Nathan Monell, the Executive Director of the National PTA, Dan Domenech, the Executive Director of the American Association of School Administrators, and finally, Dr. Samara Brown, a top board-certified primary care physician and pediatrician and founder of Little Lives PPE. Take a listen.
Together, our voices will not be silenced or denied. We had hoped that COVID was going to be in the rearview mirror and we would have almost normal school opening and there would be a lot of joy this year, but Delta threw us a curveball. And this is about really trying to answer people's questions about what's happening right now and what we need to do. And the bottom line, let me just go through our North Star and what I think our goal is, which is how do we achieve a safe reopening of schools? Not only a reopening, but to keep our kids there. We know the benefits of in-school learning. It's obvious. Every teacher in the country could tell you this. Every bus driver could tell you this. Every parent can tell you this. But given the Delta variant and given the curveball, how do we keep our schools open? How do we keep people safe? How do we keep our kids safe? Particularly given that those under 12 can't get the vaccine yet. And how do we also do not just about safety, but how do we recover? And how do we help our kids recover? And how do we help our kids not just survive, but thrive, get their mojo back, and have a school year of joy and of learning? That's what I think our goal is. And that's why we are super, 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 super careful about safety now. But as important as vaccines and masks are, and they are really important, there are other things that are important as well in terms of emotional and social learning, about academic recovery, and about how we work with and respect each other. So we have a lot of medical professionals on tonight, Dr. Cantor, Dr. Brown, Dr. Murthy, and they're going to talk about different things, and from social emotional issues to obviously about vaccines and the myths about fertility and breastfeeding and vaccines and how these vaccines were approved and created and approved. And I want to make sure I am not a doctor. I want to make sure they get to answer these questions. And so with that, let me turn it over. First, let me introduce U.S. Surgeon General Dr. Vivek Murthy. As I said, he has another engagement right after this. But let me tell you, he is a physician and a vice admiral in the United States Public Health Service Commission Corps. And he has served, as I said before, the 19th and now the 21st Surgeon General of the United States, first under President Obama and then President Biden. Dr. Murthy is the first Surgeon General of Indian descent, and during his first term as Surgeon General, he was the youngest active duty flag officer in the federal uniformed service while serving in office. And I say that as we honor the 13 of our heroes who died in Afghanistan evacuating people. Their memories are a blessing to us, and we know the service is so important. You have been a voice of reason and expertise throughout the pandemic, and we are thrilled to have you join us. Thank you, Dr. Murphy.
Well, thank you so much, Randy. And I just said at the start, I just want to say how much I appreciate everything you've been doing to keep our kids safe and keep our schools open and reassure parents and educators across the country. Look, I wanted to be here tonight. I've really been looking forward to this event for much of the week. But I wanted to be here not just as Surgeon General or as a doctor, but as a dad, as a parent myself who wakes up and goes to sleep every day thinking about how to keep my kids safe, the same way I know so many parents on this call do as well. And I've just always appreciated, during this pandemic, how challenging it has been for parents. We have recognized that parents had a tough job before the pandemic, and then you had to figure out how to homeschool your kids while teleworking and figure out how to manage the unfolding pandemic, not being clear when it was going to end, but recognizing it was having an impact on you and your kids. I think educators as well have done just such a heroic job managing the uncertainty during these times, doing what they do every day, which is to put our kids first. And I know as we approach the fall, we have to go through these next few months just recognizing how important the well-being of our kids, but as well as our parents and our educators are. If our parents aren't well, if our kids aren't well, if our educators aren't well, then we are worse off as a society. And that is why we have to, as a society, put everything into making sure our kids are safe, that school can continue in a safe, sustained way, and that ultimately we can all do better as a result. I will say that as we come out of, go through these next few months, and hopefully as we get to the end of the pandemic in the days ahead, my hope is that we will never forget what parents and kids and educators have endured during this moment. I don't think we talk about it often enough as a country. I don't think we appreciate fully the anxiety that a parent sits with every day as they imagine sending their kid to school during difficult times with this Delta surge. But that's what we think we have to keep in mind, because we've got to make sure we are doing everything we can to support all of you and to support our children. A couple last things I just want to say, and I'm eager to get into the questions that we have today, is, I want you to know also that while we are in the middle of this surge, and while we are seeing, unfortunately, cases continue to rise, overall in our country, there will be an end to this pandemic. That end will come as we get more and more people vaccinated in our country and protect more people from hospitalizations, from severe infection, which is what the vaccines are designed to do. But between now and when that time comes, and we can't predict exactly how long it will be, we do have steps we can take to keep ourselves safe, to keep our families safe. And that's what we're here to talk about today. And I just also want you to know that as long as this pandemic goes on and in the recovery that will take place afterward, I certainly want to be here to do everything I can to support you and to help in any way that I can, as we all get back on our feet. And finally, just consider this also, during hurricanes and tornadoes, during major, if you will, like the natural disasters that we go through, there's always the acute effect, the destruction and the damage that we see around us. But then we also know that there are mental health effects that come from these experiences of trauma. And sometimes that takes longer to actually fully understand and to address. I think this pandemic will be similar in that regard. There are already mental health impacts that we see in ourselves, in our own lives, in our children's lives from this pandemic. And we have to be prepared and committed to address that as a society as we move forward, because this is about getting our kids back into the classroom, but it's also about helping them heal. It's about ensuring that we understand the full impacts of this pandemic, and we are there to support them in growing, in developing, in strengthening themselves, in developing more resilience, but ultimately in healing. That's the word that so often comes to mind as I think of what our kids need in the days and months ahead. So I'm eager to get into your questions, but I just want to appreciate, again, you being here and thank you for everything you're doing to keep our kids safe and to make sure they can not only come back to school, but ultimately stay in school, which is what we all want.
Thank you so much. We've been getting a lot of questions right now about what does the program look like in a school? And Have we lowered class sizes, and do we have enough nurses and guidance counselors, and all the questions that I've peppered Pam Cantor with for weeks and weeks already. But what we're getting instead is questions around the fear about the vaccine. So let me ask you the two major ones that I've gotten in various different ways. One is, people have said, particularly people who, young women and young men who, want to have families. I hear this a lot. I'm scared about the vaccine. I've heard it's going to make me infertile. Is it safe if I'm pregnant? Or can I get pregnant? What happens if I'm breastfeeding? It seems like the approval process was rushed. So, it's the fertility, the breastfeeding, the pregnancy. I get this question a lot from the people who are hesitant about the vaccine.
Yeah, well, I'm glad we're talking about this, Randy. And first of all, I just want to say for folks out there who've got questions about the vaccine, that's perfectly fine to ask. I know sometimes people can feel like they're made to feel ashamed somehow if they've got questions about the vaccine. We want people to get their questions answered. Before you put something in your body, it's good to know what the facts are. So let's talk about the facts for a moment. So there are unfortunately a lot of myths about the vaccine that have been circulating. And I'll tell you that, misinformation has been floating around for a long time, but what's really different now compared to, let's say, 10 years ago is the speed and the scale and the sophistication with which this misinformation spreads. I've had, colleagues who are trained in healthcare who have sometimes fallen for some of these myths because, again, it's not easy to sometimes tell what's true and what's not. So with that in mind, let's talk about one of the most common myths, which is about the process to which the vaccine was developed, the notion that it was somehow rushed. This vaccine was not rushed. And in fact, the mRNA vaccines in particular, the Moderna and Pfizer vaccines, those have been built on platforms that have been under development for more than 2 decades. The Johnson & Johnson vaccine, that too has been built on a platform that's been in development for many, many, many years. The culmination of all of those years of work gave us the vaccine that we have today. Now, typically, vaccines take many more years to develop. But what happened in this case was really an unprecedented effort, global cooperation between scientists, and really an effort to cut red tape, to say, you know what, let's not do things sequentially with a long period of time they normally take. Let's instead see how we can get companies to work in parallel, doing the same thorough, careful work they normally do, but doing it in parallel so that we can have more options. Even if that means a couple of our options fail, but we have 2 that work really well, then we'll take those 2, even if that means we got to invest more money. So there was more money spent, more red tape cut to make sure that we had vaccines available to us more quickly. But here's the really critical part. There was nothing that was shortchanged in the evaluation process. And this is really what matters, because what you want at the end of the day is for the Food and Drug Administration, the FDA, which is our gold standard for safety and effectiveness, we want them to be looking and scrutinizing the data really closely to see, is this safe for people and is it going to be effective for people? And they did their job in that regard. And in fact, you see the fruit of their efforts borne out. Over the last many months, we've delivered the vaccine and administered the vaccine to more than 350 million times in the United States. And that's why we've got millions of people here vaccinated. We have many millions more around the world who are vaccinated. And there are 2 things that we've learned during that experience, is that the vaccines have actually been remarkably effective, especially in keeping people out of the hospital and preventing them from dying. But also the vaccines have had a remarkably strong safety profile, which means that the side effects that are seen are so rare, and especially as compared to the bad effects of the virus, that it's very clear that the benefits by far outweigh any risks. So that is true. But a couple of the points I just want to make about myths is that a common myth out there is about the vaccine causing infertility or about the vaccine being unsafe during pregnancy. So here's the facts. We know that there is no evidence at this time in any way that links the vaccine to infertility. In fact, there are many, many cases of people who have actually gotten pregnant and had healthy pregnancies shortly after they got vaccinated. The CDC has also studied the experience of pregnancy very closely. And what they have found is that when people have received vaccines early in pregnancy and later in pregnancy, that there has been no ill effects in terms of an increase in miscarriages or other adverse effects that we would worry about. In fact, they do just fine. The flip, though, is if you are not vaccinated during pregnancy, and if you get COVID, you actually have an increased risk of bad outcomes compared to someone who's not pregnant. You have a greater risk of being hospitalized, of ending up in the ICU, of having preterm labor and preterm delivery. So all reasons to get vaccinated. It's not going to hurt your pregnancy. It's actually, even if you're breastfeeding, one thing we know is that when you get vaccinated and your body develops antibodies, which are the army of soldiers that help prevent infection, you pass them on through breast milk to the baby as well. So that is actually a way to help protect yourself and your child as you're breastfeeding.
So the other question I get a lot is that there's a lot of there's a lot of, I tease, I say confusement, but at the very beginning of the vaccines, it seemed like the vaccines didn't simply, as you said, prevent people from being hospitalized or dying. They prevented transmission. They seemed like they were just super, super, super on everything. And so now, with breakthrough, cases, with, people getting COVID, with it not preventing transmission, there are a lot of people that say, why is the vaccine important? Since it seems like we have these breakthrough cases, it seems like it doesn't prevent transmission. And why not? If I got COVID before, don't I have the immunity that is as good, if not better, than the vaccines? So I know that's a lot of questions together, but it's the same ilk.
Yeah, absolutely. These are great questions, Randy. And so here's what's important to know. The most important reason to get vaccinated is to save your life and keep you out of the hospital. Full stop. That has not changed from the beginning. It's still true today, as true as it was in the beginning. What we have seen with the Delta variant, and keep in mind, this Delta variant, which became the dominant variant in our country this summer, this is a different beast, if you will. It's far more contagious, and it sort of takes more of that army, if you will, of soldiers that we've built up in terms of antibodies to actually defend us. And what we've seen is that there have been more breakthrough cases in terms of mild and moderate infection, right? You're still much less likely to get infected, even with a mild infection if you're vaccinated versus not. But you may have a breakthrough infection. We'll see that in a small portion of people. But here's the thing. Even if you have a breakthrough infection, it's much more likely to be mild or even asymptomatic, which means you don't feel anything, compared to those who are not vaccinated. It's one of the reasons why the vast majority of people who are hospitalized are in fact unvaccinated right now. And you might ask, well, does this really apply to kids though? Because some kids do really well with COVID. Now, thank God our kids do well overall, and so the likelihood that a child gets seriously ill or dies because of the virus, God forbid, is much less likely than somebody who may be a senior citizen, for example. But here's what we know. Given how many people have been infected, including kids, we have lost hundreds of kids during this last year and a half due to COVID-19. We've had thousands of children who are hospitalized. We are seeing hospitalizations now, in fact, at an all-time high for children. And so while kids do better than older adults, for sure, this is not a benign illness in our children. And we should do everything we can to reduce the risk to our kids. And that's why these steps that we have been talking about, especially getting vaccinated, is so important. Now, if your child is too young to be vaccinated, which is the case for my kids, I have two kids who are below the age of 5. Actually, one's going to be 5 tomorrow, and another one is 3.5. And so they're too young to get vaccinated.
Happy birthday to them.
Thank you. Thank you. My son has already made multiple requests for gifts and for types of cakes that he wants. So that is my job this evening, is to pull all of that together. So, but one of the things that we know is that to keep our unvaccinated kids safe, who are under 12, it's especially important that the people around them are vaccinated. Our kids who are unvaccinated depend on the rest of us to shield them from infection. And we can best do that when we are vaccinated. But it's also why some of the best practices and recommendations that Randy and AFT and that the CDC and others have been talking about for schools are so important. Because we know that with a combination of testing and masks and distancing whenever possible, that we can actually make the school environment safer for our children. And that's really what we've got to do. So the bottom line is that the vaccines still work remarkably well to keep you out of the hospital, prevent the worst effects of COVID. Some of the reduction in protection against mild infection is why we believe that booster shots will likely be needed down the line. But I finally about that just want to say that is not unusual. If you look at all the vaccines that many of us have gotten over the years, many of them require multiple shots. Take the hepatitis B vaccine, it requires 3 shots. The measles vaccine requires multiple shots. People get tetanus boosters, every 5 years or so. Additional shots are not unusual. And it's very possible that this will end up being a 3-shot series, to have lasting protection against COVID-19. So vaccines will ultimately be our way out of the pandemic. And that's why it's important to get vaccinated now. Until you get vaccinated and have full protection, taking some of these, what are called mitigation measures, like the masks, et cetera, this is really, really important to help reduce the chances of spread. And if I could just share one last thought, just in parting to all who joined us today. Look, I know that this is a scary time. And, my responsibility as a public health person and as a doctor, as a fellow human being and parent who's going through these challenging times as well, is just to be as open and honest with you as possible about what we know and what we don't know. And as we learn more, to share that with you as well. And that's what I am committed to doing. But I also know that to get through this pandemic, it's going to require us sticking together and supporting one another. Everyone may have experienced this pandemic differently, but we've all been deeply affected by it. It's changed our lives in many ways. It's changed and affected our kids' lives in many ways. And there are going to be moments in the days ahead as we get our kids back to school and deal with new questions that arise or moments of uncertainty where we're going to need the support of other people. And so this is a time where it's all the more important just to reach out to fellow parents to make sure that we're staying close to our kids, making sure that they know that we're there for them. And I will say that, as a doctor who's prescribed many medicines over the years, it has always struck me that the most powerful medicine we have, the most powerful source of healing that we have is in fact the love that we give one another. And in moments like this, when our kids are wondering about what the future is going to look like, them being reminded that we love them, we are there for them no matter what, that is perhaps one of the most powerful things that we can do to help our kids move forward. So I appreciate everything that everyone is doing here to get our kids back to school, keep them safe. I'm here for you, Randy, happy to do town halls or anything else together anytime to make sure we're supporting parents, educators, and most of all our children.
Thank you. And we will take you up on that. Thank you so much.
Of course. Take care.
Thank you. Next, and I have referred to her a lot because Dr. Pam Cantor teaches me a lot all the time. She's a physician, she's an author, and she's an expert on learning, development, and education equity. She is a practiced child and adolescent psychiatrist for nearly 2 decades, specializing in trauma. She founded Turnaround for Children in 2002 after co-authoring a study that assessed the impact of the 9/11 attacks on New York City school children as we are 20 years after those attacks. So I'm so grateful that Pam is here. And then I talked about Dan before. He is Dan Dominici. He's the executive director of the American Association of School Administrators. Dan has more than 36 years of experience in public education, 27 of those as a school superintendent. Dan began his teaching career in New York City, where he taught 6th grade in South Jamaica, Queens. And I'm so glad that Dan is here with us as well. And finally, let me welcome Dr. Samira Brown, who has taught me more than anybody else about masks. Samira is a pediatrician and founder of Little Lives PPE. I tend to have my best conversations with doctors, by the way, as I'm going in and out of planes, which I have had with Dr. Cantor and Dr. Brown. Dr. Brown is a board-certified primary care pediatrician who grew up in New England. She completed her pediatric training at Boston Children's Hospital and Boston Medical Center, which, for those of you who are not pediatricians, is the nation's top residency program. She decided to return to New Orleans post-Katrina to help in that city's recovery. And I'm sure you are aching for the folks who are now devastated because of Ida. You became the medical director, both her primary care clinic and her newborn nursery focusing on childhood obesity, breastfeeding promotion, and quality of care. She has over 10 years of clinical experience caring for children of all ages. And I went through her bio because everything about pediatricians now are so vital for us to know. So Nathan Manel is the executive director of the National Parent-Teacher Association. It's America's oldest and largest volunteer child advocacy association. They have 22,000 local units, nearly 3.5 million members. And we all know how important our PTAs are and what we need to do and what they do and how we rely on them in terms of and how they rely on and make sure that our kids' children are thriving. So Nathan has been an outspoken advocate for equity in our schools, and we're really thrilled that he's here with us tonight.
Thank you so much, Randy. It's a pleasure to rejoin you for this town hall to talk about the issues that we all share in common. And I have to say how grateful I am to the educational professionals and the health professionals who give us their expertise, their time, their commitment to help us through this pandemic. I don't know about all of you, but it's so wonderful listening to Dr. Murthy. I think we should call him the soothing general, and I'd like to take him with me as I go around and talk to parents. It's so good to have that transparency and the warmth that comes with it. Wow, we've been through a lot in the last 18 months. If you're a parent, you have experienced anxiety, fear, commitment, resignation, joy, small successes that might come along, concern for your children, and a desire to keep moving forward, and lots of uncertainty. As parents, our experiences have not all been the same. Some of us have suffered more than others. Some of our communities that were under-resourced to begin with experienced much greater losses than others did. Our children were sometimes our heroes as they struggled to look into that camera every day if they were going to school remotely, or if they're trudging off to school and worried about their possible infections, worried about their parents as they go to work, desiring to do the best they can. The resilience they showed was inspiring for lots of us. And we saw, of course, the pain and concern we had for them around their socio-emotional position in life and also their academic struggles. But we're proud of what we all did to get through this pandemic together, and we're so sorry for those people we have lost. And so then we were ready to be joyful, as was mentioned, in our return to school this fall and some level of normalcy. And the Delta variant has hit us quite hard. And a lot of us who had hope now have reticence or fear or concerns. And so it's time for us to just revisit and think about our own commitment about what we want to be doing this fall. And I want to say for National PTA that it is our belief that a return to school, to reopen the schools, to have our students go back to that environment is vital to the continuity of education that every child needs. That's particularly true for our students who have not had access to adequate technology, that have not had the supports they need if they're in special needs students or students with disabilities. And so this return to school is ultimately important. But we have to balance that with a bookend. The bookend has to be that we commit ourselves to keeping all of us safe and the ultimate safety of our educators, our students, the families that surround them, all the staff personnel is equally important. So we're balancing two things, getting everybody back to school and getting them back to school safely. How do we do that? That's the challenge. And we're hearing it fought and argued about all across the country. This is a time for partnerships. This is a time when all of us, school professionals, health professionals, elected officials, parents, students, all come together, and that we bring our most creative, our most successful problem-solving skills to the table to compromise, to look at how issues can be resolved. It's when we partner together that we get the best results, right? And there are those who'd like to divide us. There are those who'd like to have teachers be against administrators or parents fighting amongst themselves about what's the best solution. but we need to work together. And we certainly believe at National PTA that parents are the consumers of the public education system. They must be included in the design, the delivery, the evaluation, the monitoring of any back to school plans. We all have to do that together. And when we have success, we need to share those successes. But we know when parents buy into the process, it's because they've been included in the process in the beginning, and all of us need to be skillful at engaging all parents in our community in our back to school efforts. So I have a word for parents, though. In our engagement with this work, we need to make sure that we are respectful, that we're civil with one another, that we're civil with our leaders in the schools. Our professionals in the educational environment are being somewhat chastised by parents because they can't find a solution that meets everybody's needs. So as you advocate, we encourage you to use your kind voice as your children are watching and observing how you deal with concerns that you have. So one of the ways that parents need to be raising their voices to help our schools and to help our students is to insist that schools are following the CDC guidelines. None of us, and a couple of people on this call are, but most of us as parents are not infectious disease specialists. We don't know the best healthcare for children or for our communities. And so we have to rely on people who are experts. And we have committed in our position statements to saying we should be following the CDC guidelines. The guidelines are clear. They might change at times because the virus changes at times. The pandemic changes at times. So we must follow those guidelines. The multi-layered strategies that make sure that we keep all of our students and educators safe. All those pieces. Dr. Murthy just mentioned all of them, but it's masking and vaccines. It's the cleaning of surfaces, it's ventilation, it's social distancing, it's the ability to quarantine we need to, all those factors together, because we have to keep our children safe. We have to keep our educators safe. And I just want to say a word about vaccinations. National PTA has been supportive of timely inoculations for a long time. And we believe now, as much as ever, that vaccines are a way for us to create safety for all of our students to be there. In the meanwhile, we will be working with all of you to support our communities and to advocate at the federal, state, and local level for the best outcomes for our students, not only academically, but also socially, emotionally, and in their physical health. Thanks, Randy.
Thank you, Nathan. So, Nathan, Marie, who's a parent from Albuquerque, and she wrote us earlier, so I want to raise her question. This was what she said. We hear so much about computers being purchased and other equipment from schools, and they're getting that money from the rescue plan and things like that. But she's not hearing enough about ventilation, and I'm seeing some of that in the chat as well. So she's wondering, are you hearing that? Is PTA hearing that from a lot of different places about ventilation? And what are you suggesting, people should be doing on a local level to get the ventilation systems fixed?
Great. Thank you for that question, Marie. We're hearing that a lot. And, ventilation isn't sexy. It's not terribly controversial. It's not getting a lot of attention in ways that other issues are. Most of us know just enough about it to be dangerous. And so I think we want to applaud your concern, and we share it with you. We've heard from a lot of our parents, particularly those who are in under-resourced schools, where their buildings are crumbling, where they're outdated, that they're very concerned about the ventilation systems. But in fact, we have a survey coming out tomorrow that says that 77% of parents believe that ventilation is either the most important or a very important factor in returning to schools. And so that concern, they rank similar to how they look at keeping kids calm when they're sick, or hand washing and other disinfecting activities. And so they rate it very highly, and they have reason to be concerned. As we all know, the GAO put out a report that said that in 1/4 of our school districts across the country, at least half of the schools in those districts are reported to have needs for serious updates to their or replacement of their ventilation HVAC system. So those fears are justified. And we invite you to join us in advocating on this issue. In the reconciliation, we're looking for $100 billion in direct grants and $30 billion in bonds for school infrastructure. And we certainly would encourage you to advocate for that with us. It's a level of investment we need in order to have proper ventilation in our schools. But in the meanwhile, I'd encourage you to go to CDC. They have a page there called Ventilation in Schools and Child Care Programs. They're easy suggestions for ways that you can make sure that right now, wherever you are, your school's doing the best they can, from making sure your current system is serviced and meeting code requirements, making sure that your HVA systems are set to bring in as much outdoor air as it possibly can in a safe way. And so go to that page. It's called the Ventilation in Schools and Child Care Programs. Thank you for your question, Marie.
Thank you, Nathan. We're going to go to Dr. Cantor next.
Thank you so much, Randy, and thank you enormously for your leadership on what we're talking about today. You know, we're living in a paradox, a COVID paradox, where to stay physically safe, we've had to be physically distant from some of the most important people in our lives. That can work for a while, but separation from friends, teachers, schools, coaches also carries risks. We don't always immediately see the risks of loss of connection, the way that we see the risks of catching a deadly virus. But this too is a serious risk to a healthy, robust childhood. You see, learning is fundamentally a relational enterprise. It's even a biologic enterprise. We don't talk about it that way, but here's the biologic story. Relationships release an army of helpful and powerful hormones. One of the most powerful of them is the hormone oxytocin. In fact, if I asked each of you to name the most powerful influences in your lives, it would likely come down to a person. That's what most kids say when they're asked that question. A parent, a coach, a teacher, a friend. It always comes down to a person. So this hormone oxytocin is so powerful because it not only buffers the effects of stress, it can build resilience to future stress, including the ongoing uncertainty and disruptions that we and our children are living with. Oxytocin is one of the most powerful engines for igniting learning, for unlocking motivation, and even wiring the brain. What it does is it connects brain structures so that we can learn to read, ride a bike, or solve a complex math problem. In fact, all of the complex skills that we learn happen because the brain becomes more and more connected and wired. And the fuel for that process comes from hormones like oxytocin that are released when we learn through the experience of trusting human relationships. The love that Dr. Murthy spoke about. We can't live well, we can't learn well without this hormone. The human relationship is the most powerful example we have of positive context. And consistent relationships with parents, siblings, and peers, and very importantly, teachers, are what we're talking about. Maybe you see where I'm going. There are big risks to children not being in school, but I don't hear some of them being talked about enough. Of course, like you, I hear a lot about instructional loss, but this one is even bigger. The biology of the human relationship is the essential foundation for a healthy childhood, and frankly, a healthy adulthood. And the risks to children not having enough of relationships or oxytocin is huge. So we have a big risk-benefit problem on our hands with COVID. And if you had asked me, could I come up with a medicine for this that is both high benefit and low risk? Well, that's where I'm going next. Recently, Linda Darling Hammond and I published the Guiding Principles for Whole Child Design. It's a playbook of resources for leaders and teachers that help schools get prepared to develop the whole child. That means their well-being, their social, emotional, and cognitive skills, and of course, their academic competencies. That's what we mean when we say whole child. The AFT has gotten behind the importance of whole child design, and Dan's organization, AASA, is supporting the scaling of whole child design across the country through its Learning 2025 initiative. You're going to be hearing a lot more about this, and you can access the playbook for free on Turnaround for Children's website. The 5 principles: positive developmental relationships, safety and belonging, rich, engaging learning experiences, the intentional development of the skills, habits, and mindsets that all successful learners have, and of course, integrated student supports. When schools are designed using these 5 principles, we solve for relationships, safety, and learning. In other words, we get the benefit and we drive the risk down. So is this worth fighting for? I believe a healthy childhood is worth fighting for. Everything in medicine, and frankly, life, is a risk-benefit decision that we make. The benefit tells you that the fight's worth it, even if we can't always drive the risk to zero. Not in a car, not in a plane, not taking Tylenol or taking the vaccine. My headline is that there is a big risk in children not being in school, a risk at the level of their biology, their well-being, and their learning. And we can reduce the risk and get the benefit by making our schools and all of our learning settings whole child settings, by keeping ourselves and others safe through masks, vaccines, ventilation, hand washing, and frankly, every other tool at our disposal. It is worth fighting for. We likely still won't drive the risk to zero, but the benefit for us all in seeing our children lean into their childhoods, into their learning, and into the futures they choose, it's worth fighting for.
Thank you so much, Dr. Cantor. And, every time you speak about I learn, I said this before, but I learned so much, and I've just written a whole mess of notes as well. There's so many questions for you, Pam, and I'm just going to throw 2 of them out to you, which is one from a mom who's anonymous, who says, how do I keep, my kids, I have a kid who has autism. Mm-hmm. The child finds it really hard to keep a mask on. So what do I do? And what do I do in school? And then I have the teacher stress question that I'm going to ask in a minute too.
Okay. One fast thing, picking up on where we just were. I got an email yesterday from Linda Darling Hammond in California, knowing that I was going to do this with you today. And she wanted me to know that an op-ed appeared yesterday, which I recommend that everybody listening in goes and takes a look at. 97% of kids in California are in school.
Yeah.
Okay. And what she did in the op-ed is what Dr. Brown just did on this in this presentation, which is making the point that there are several things that have to be done together to get that result. Some of them are environmental, ventilation, HEPA filters. Some of them are creative, which I'm going to get to with the question you just asked me, of just, can kids be outside? Can kids do things that enable them not always to be indoors? But the main thing is there are at least 5 strategies mentioned in that op-ed that contributed to a 97% return to school. So when you think about kids with special needs, like a child with autism, okay, they're not going to want to wear masks continuously. How do you make it fun? How do you incentivize it? Some of the wonderful things I've been seeing is that kids decorate their masks with things that capture their identities, their superpowers, their names, okay, because they start school and nobody can see their face. So we've got to be thinking of how to engage kids. So this is something they want to do. They take it on. You make it fun. And then you even allow kids to show you how well they're doing so that they get a tremendous amount of positive reinforcement. Most kids don't do what we want them to do if we say the word don't. Okay? Most parents know this is not a winning strategy. So we've got to make it fun and we've got to make kids embrace it.
Thank you. I get this all the time. We're feeling as teachers really stressed. We're feeling unsupported. We're overwhelmed. There's a lot of anxiety for us too. We want to be in school, but we've got a lot of anxiety about this. And, we never want to hear the word hybrid again. We never want to do this. How do we deal with our own stress levels? And and given that 78% of teachers last year felt really stressed, what kind of coping mechanisms should we do as teachers in terms of navigating through this year?
So one of the things that Dan took leadership on with superintendents, who next to teachers are among the most stressed people in the United States right now. And one of the things we worked on together was focusing on the wellness of the adults. And we did 3 sessions with superintendents. The most important part of those sessions, when I did all the usual stuff of talking about wellness and stress management and things that people must do around sleep, nutrition, meditation, exercise, all of these things. But the biggest deal to the superintendents was that someone wanted to listen to them. Somebody wanted them to be heard and to be responded to. And what is going on right now that is causing a tremendous amount of teacher stress is that they don't feel that they are being heard by their leaders, by the boards of education, by the tremendous conflicts that are going on. So one of the things I say when teachers ask me about this is whether it is possible in their setting when they don't feel heard to bring together a PLC, a professional learning community, where teachers support one another, swap stories, bring in experts, and begin to create a power base from which to pressure leaders to do the right thing. And everything I'm talking about, is the power of the human relationship, and that goes for adults too.
Thank you, Dr. Cantor. Thank you, Pam. Dan, since, the soups are essentially, whatever sports analogy you want to use. We thought we were on the 5-yard line and now we're back to our own 20.
It's been quite a turnaround, Randy. And thank you, by the way, for having us join you this evening. It's always a pleasure to work with you. Yes, I remember just a month ago, last July, the optimism was incredible. We had actually our first in-person conference in DC, and it was a great turnout of superintendents. It was an advocacy event. And we were all talking, all superintendents, how exciting it was that we would be able to reopen schools. Not necessarily exactly like normal, like it used to be, but definitely that we were looking forward to the kids coming back in person. All of us that have been in the classroom as teachers and as educators remember how exciting that first day of school was for the staff as well as for the kids. Well, as we know, things turned around dramatically by August, and now what we're seeing is that even though almost half of the school districts around the country have already opened for instruction, the impact of this new strain is causing really many districts already to begin to have to quarantine youngsters, to actually begin to shut down, even though that was certainly not the expectation. It's been a very difficult year. And I think it's important to note as well that this is the third school year that's been affecting our students. A youngster that went into high school as a sophomore when this COVID started is now in their senior year. And all they have experienced throughout most of their high school life is the pandemic. So the amount of impact that this has had on our students, the loss of learning, really, as a result of so many of our youngsters. Remember that over 14 million of our students last year and at the beginning of the pandemic never had a laptop or a computer and never had internet access at home. So for many of those students, remote instruction never even happened. And so we were looking forward to beginning to reclaim these youngsters as they came back to school this year. And that is becoming an issue. And superintendents, unfortunately, have had to face the brunt of their communities, because if they didn't open schools, they heard from the parents that needed their children to be in school so that they could go to work. If they did open schools, then they faced the brunt of parents who said, "What are you doing? I'm not going to send my child. It's not safe for them to go to school." Most recently, it's been the issue of the vaccine. Even though there is a vaccine available for students of 12 years and older, there is a hesitancy on the part of parents, many parents, to have their children vaccinated. So that's becoming a problem. Even though probably on the average, there may be maybe 40%, 50% of students that the middle school and high school age group that have been vaccinated, still many more have not. And then, of course, the other major issue that we all recognize is that there is no vaccine for students that are younger than 12. So for most school districts, half of the student population, there is no vaccine. And for the other half that there is a vaccine, maybe half of them have been vaccinated. So that's still a very small amount. I congratulate Randy and the AFT for their urging all of their members to become vaccinated. That is obviously critical. We know that the number one mitigating factor is the vaccine. But if we can't get the vaccine, then the second most critical mitigating factor is the wearing of masks. So certainly for our younger students, the wearing of masks is essential, and even at the high school level. Yet we're encountering the tremendous resistance in many parts of the country from parents who don't want their children to wear masks, really from officials at the state level who would not allow school districts to impose a mandate requirement. And that is creating really an untenable issue at this particular point in time that may very well impede the ability of bringing youngsters into school in person. And that's important. But throughout this whole process, I think the key thing, the important thing to bring up is that for superintendents, and that's what we have urged as the organization, the association that represents them, is that number one factor is the safety and welfare of the students and the staff in the buildings. That is the most important element of this whole process as far as superintendents are concerned. They need to do whatever is necessary to ensure that safety. So vaccination is key. And then the wearing of masks is as important. And then within the schools, continuing the process. And Dr. Murthy has done an excellent job in outlining all of these necessary mitigating steps. The spacing were appropriate, the cleansing were appropriate, protective equipment were appropriate. These are the things that need to be done to ensure that the kids are safe. I am proud of our superintendents in states like Florida and Texas, who, against their governor's wishes, have insisted and mandated that masks be worn in their schools, even though they're being threatening with the loss of pay, the loss of funding, and all of these other issues. Yet they're still doing it because they believe in how important the safety of these children is. Another factor, very quickly, has to do what we've heard already regarding the social and emotional needs of the students. I'm also proud when I've heard superintendents on the opening days of school tell their teachers, look, the academic is key. We certainly know that it's important, but I don't want you the first day of school to, as soon as the children walk into the classroom, say, open your math book to page 44. No, what I would like to hear you do is on that first day when those kids come in is to say, how are you doing? How's your family? How are you feeling? How has this experience been for you? So these are key elements of everything that's going on right now in our schools. And I think that together with the teachers, with other staff members, with our medical personnel, do everything we can to ensure first and foremost the safety and welfare of the children we serve and the staff that works with them. Thank you, Randy.
Thank you, Dan. And Dan, in the chat, there's a lot of questions, and near the close, I'll answer a couple of these myself. But in the chat, there's a lot of questions about people saying that they don't feel safe. And, there may be teachers, they may be parents, they may be others, but they are saying, you and I just talked about, how amazing some of these superintendents have been in Florida and in Texas. All of us have talked about these protocols about vaccines and masking. So what do you think we should do? This is the question. How do we get to universal masking? How do we fix these ventilation systems? Do you have any suggestions about how people, maybe they're not in our locals, and I'll advise some people in our locals at the end how to do this, but how should we operate together with superintendents to actually do these kind of layered mitigation that we all just talked about?
So yeah, Randy, you're absolutely right, and people have reason to not feel safe. When we see, what's going on right now, we just heard from Dr. Brown and Dr. Cantor and Dr. Murthy at the very beginning, what's happening, how right now we're at a point that we thought we'd never be here, and we're just returning to where we were last year. So there's no question about it. What we all have to do is to work together to try to put in place what we know, what Dr. Murthy and all of our medical personnel are telling us are the things to do to be safe. And clearly it's the vaccination process. Clearly it's the wearing of masks. Clearly it's the ventilation, doing all of these things. The problem is that, when I talk and you talk about schools being in person and safe this year, there are parts of this country, there are many parts of this country that will open, that will be safe, because those are the areas of the country where the vaccination rate is high and the infection rate is low. That's not going to be the case in areas of the country where it's the very opposite. So until we can all get together and ensure that the vaccinations are being given, to ensure that the kids are wearing masks, because that's what's going to protect them, and that happens, that's when we'll begin to gather the kind of mass immunity, if you will, herd immunity that we hear so much about. But it's not going to happen until we work together and we make these things happen. No superintendent is going to want to bring either staff or students into the school in person where they feel it's not a safe environment. Well, I was talking to you, I just got a text from a superintendent in Oregon that was fired by the board overnight because he insisted that the students wear masks and the board disagreed. So these are the kinds of things that we're facing, that until we get together and we work together to do what we know is the best thing for our kids, that's the only way. And we've said it, you said it before, Nat has said it, we've all said it. We have to work together to make sure that this happens.
Thank you, Dan. Just two things. That our leadership and our membership in Florida and in Texas has been supporting the very, very brave superintendents who are essentially risking their jobs and everything. And so we are supporting you, and you know that, and they know that. And in fact, I will be down in Broward and Dade later this week, both in terms of back to school and as a show of support and solidarity. And the second thing I want to say is that I have seen, and Nathan knows this as well, but in the places where people are really figuring out how to work together, they are solving these problems. I just want to lift up, yesterday I was in Lynn, Massachusetts, solving these problems. St. Louis, solving these problems together. The places that have learned the muscle of collaboration and of working together doesn't mean that everything is, just just a day in the beach, but they're really, really working together. And when we have parent groups and teacher groups and superintendents working together, we create transparency, we create trust. And I just want to say to both Dan and Nathan that those places, it's obvious, and it really is bringing back the relationships that Pam Cantor just talked about. The so important, that relationship safety net that happens because of the collaboration. So I just want to say to both of you, as I bring Dr. Brown in, thank you very much. That's what I've observed in my travels. And Dr. Brown, I forgot to say where you're the medical director, which is in Piedmont, or you will say it exactly right, because I probably will not. Piedmont Physician Pediatrics of Covington. But I do want, you're new to this process, but I do, look, my sister's a pediatrician. I probably talk to her now more than I talk to almost any other living being other than my grandchildren and my wife. But, we have I'm constantly asking my sister, well, what about this? And what about this? And what about this? I'm sure you are. You get questions all the time, not just from your patients, but from others as well. So give us a sense about what's going on with Delta and kids and what we can advise parents and teachers and kids about this.
Yeah, Randy, thank you so much for inviting me here. I am absolutely inspired by the advocacy, work that you're doing and your support of masking in schools, of getting vaccinated against COVID, because it's absolutely imperative to make sure that as kids come back to school, because we know that school is absolutely essential, right, to the health and the well-being of all children, that we do it in the safest manner. And we certainly can't do it without both of those things happening, and certainly vaccinating for all who are eligible. And we understand that families have lots of questions, and every single day, I answer questions, and you're right, for both my family, my friends, and of course, all of my patients. And so we understand that you're going to have questions, and we want you to ask them and get your information from a reputable source. And we're going to be honest about what we know and what we don't know. And we know that this pandemic can be exhausting, right? We are 18 months in, and things change as we learn more about COVID. And certainly at the beginning, there was misinformation about whether or not kids could even get COVID, right? Could they even spread it? We know 100% that kids can get COVID and they can spread it. And to date, there have been 4.8 million cases of COVID in children. And while most children are going to have either no symptoms or very mild symptoms and get better on their own and be taken care of at home, it is not always a benign illness in children. So we want teachers, administrators, families to also be aware that children can suffer from very serious complications from acute COVID, and 1 in 100 children who have acute COVID end up with a hospitalization. And while it's rare that a child will lose their life to that acute infection, it does happen. There are also post-acute sequelae of COVID that children can suffer from. And those are two different syndromes. One you may have heard a lot about that's rare, but a very serious complication, which is called MIS-C, or multi-inflammatory syndrome in children. And it presents with several days of fever. And it's important for families to understand there's not always a known history of COVID in these children. And if they have signs of inflammation in other organs, they definitely need to be referred to their pediatrician to have this ruled out. And approximately 76% of these children are actually cared for in the ICU. And 1 to 2 out of 100 of them lose their life. And when it comes to long COVID or long haul in children, we know that does actually happen. So if you have students in your classroom who are complaining about fatigue, chronic headaches, they've got brain fog, we want to keep long haul on our minds and, again, refer them to their doctor so that they can get a workup and think about long haul. So with that in mind, the question is, where are we with the Delta variant? We understand that this is not what we saw a year ago. This is not what we even saw in the spring. It's twice as contagious. And when someone is infected, it's thought that you can have 1,000 times the viral load, which is why, whether you are vaccinated or not, we definitely want you to mask when you're indoors. And so that goes for all students, 2 years and up, all staff, all teachers, all administrators. And when you're masking, we want you to mask consistently and correctly. So not under your nose, not on your ear. And we want to make sure that it fits you snugly and that it filters. So when you combine vaccination and masking with all of the preventative measures that you're all very well versed in, that's the safest way for kids to come back to school.
Thank you. Thank you, Dr. Brown. Now, I'm going to end where we started with Dr. Murthy on vaccines, and then I'm going to give a couple of closing comments. There's a lot of questioning. As I said, 90%, at least by our polling, 90% of our members have taken the vaccine voluntarily. And there's a lot of, I was on a press conference earlier with Dr. Patel and Dr. Redliner, where they really pushed very hard for, vaccine mandates because of, because kids under 12 can't get vaccines because of the Delta virus. But people are asking the following question, and I don't know if you can answer it or not. They're asking if the vaccines don't fully stop transmission anymore, why is it absolutely important for the adults in a school to all be vaccinated? And I figure, as a pediatrician, I'm just going to throw that one to you, as opposed to me attempting to answer it.
No, I mean, that is a great question, Randy. And we get this all the time. This is the first time that our country has really gone through in a while, a new vaccine coming out. And so I think it's a great opportunity to educate our families about what vaccines do and what they don't do, right? We know that these vaccines are safe and that they're effective. And there's no vaccine that's going to be 100%. But we know that every single vaccine that we have here in the US is effective against the Delta variant. And just like Dr. Murthy emphasized, our goal is to reduce your chance of having severe disease or losing your life to COVID. So by getting vaccinated, you can save not only your life, but also the lives of your loved ones. On average, someone who's infected with Delta can infect up to 4 people for every single person who's infected. And there is a 20-fold decreased risk to you personally of ending up in the hospital or losing your life when you're vaccinated. So there's a huge difference in being vaccinated or being unvaccinated. And the way that you protect children, just like we protect infants who are unvaccinated, is for the community around these children to be vaccinated, because that does help them not get infected. And that's why we need everyone who's eligible to get vaccinated. And bring your questions. We know that these vaccines are safe. There have been over 7 million doses given in 12 to 17-year-olds. And we know that it works. And we know that it's safe. So please call your pediatrician. We are ready to answer these questions. And it really is the best way to protect everyone.
So I can't thank enough. I am so grateful for Dr. Murthy, Dr. Cantor, Dr. Brown, Nathan Monell, Dan Dominich. I'm going to call you Dr. Dominich. Nathan, I'm going to call you Dr. Monell. I'm really grateful for all of you and for, spending this time with us. This is both a scary time and a hopeful time. And I want to kind of end where, Pam gave us that kind of like the alert from Linda, which I got today as well. And this is the tale of two different states. And we put the Forbes op-ed that Linda did in the chat, so everybody has it. She sent it to me today too, Pam. So everybody now has it, and I'll tweet it out today as well. And I was in California last week. There is real leadership in terms of the layered mitigation. The number of people who've gotten vaccines, 97% of schools are open. And they have actually had very few outbreaks. It doesn't mean that there won't be, but they've had very few outbreaks in terms of this. And the schools I've been to in ABC School District, in LA, in Petaluma, there was tremendous joy. Doesn't mean there's not going to be some cases. It doesn't mean we should have a process for, for quarantining and the testing and the contact tracing process. But the vaccines, the masks, ventilation, sanitation, all of that is happening routinely in California schools, including LAUSD having both testing all the time and having a vaccine mandate for all of its adults. The difference is in Florida and in Texas, there's a lot of agita, 5,000 cases of COVID for kids in Hillsborough. We see kids, we see the pediatricians telling us what's happening in terms of the intensive care units. You see a difference when this layered mitigation is there. And our job as unionists, as parents, as superintendents, as the education community, is that we should, at our local school level, if you don't have a committee, form a committee. Don't make it just your chapter leader. Form a committee. Do walkthroughs of the school. Work with the PTA. If there's a safety issue, we have a hotline now all the time. Our local leaders are involved and engaged all the time. Let's make sure we make this safe because we know what to do. If we can do this in California, we can do this everywhere in the country to make it safe because we know it's really important the third year for kids to be in school. If God forbid it gets worse, we have to deal with red lines, we will. We have to deal with a plan B or C, we will. But our first obligation is to get our kids to school, keep them there, have the resources for them, and make sure it's safe for everyone. So I want to thank everybody again for being here. I want to thank our guests again. And I want to say to everybody, I know it's tough. I know there's a lot of anxiety, but you are making a difference in the lives of kids every single day. And God bless you and thank you. Thank you, everybody.
I hope you enjoyed this episode of Union Talk. Remember to subscribe wherever you listen to your podcast and tune in every other week for a new episode. Thank you, be safe, and be well.